Hi everybody, welcome to our first ever Canadian Diabetes Association Pan-Canadian webinar. I do apologize, we did start a few minutes late today, but hopefully you guys can all hear us now. My name is Farah Ismail and I am the Program Manager for the Canadian Diabetes Association, and today I'll be your host. We are absolutely delighted that you're able to join us for the webinar to learn all about diabetes. And now just to start off, I would like to draw your attention to the survey at the top right-hand section of your screen. In order for CDA to better serve your needs, we kindly ask you provide us with your input by completing the short survey towards the end of the presentation, and we definitely thank you in advance for all of your input. Now, throughout the presentation, we will have the opportunity to type in the question and answer box, and that should be located on the bottom right-hand section of your screen. We do ask you use this box for questions you may have along the way, and our presenter, Lori, will be happy to answer the questions towards the ending of the presentation. As well, we will be displaying a few polling questions throughout the presentation and would love for your participation in these questions. And they really help CDA gauge who our audience members are. And please note that these are completely anonymous questions. Also note that you are able to customize your screen, so you can expand and collapse any of the screens that you see. So please feel free to adjust them as needed by dragging down the bottom right-hand corner of each of the webinar pods. The presentation itself will last about 40 to 45 minutes in length, and then we will have a 15-minute Q&A session at the ending. It is also important to note that it will be recorded and posted to our Canadian Diabetes Association website at a later date. Now I'd like to welcome our speaker, Lori Berard, and thank her very much for joining us today. Before turning it over to Lori, I'd like to give you a brief introduction. Lori Berard is currently the nurse manager at the WRHA Health Science Center in Winnipeg Diabetes Research Group and a faculty member at the University of Manitoba, Department of Medicine and Section of Endocrinology. She has had over 27 years of experience in the area of diabetes and is also a certified diabetes educator. She is actively involved in many research and educational activities with numerous presentations and publications. Lori has been a member of the CDA for over 20 years, and she continues to be a major volunteer in many capacities at both the local and national level. For more information on Lori, please view her full bio, which is located in the speaker section of your screen. So without further ado, I present to you Lori Berard.
Thanks very much, Farah. Good afternoon, everyone, and thank you for taking time out of your very busy schedules to spend the next 40 or 45 minutes with me learning about diabetes. And welcome to All About Diabetes and the concept of giving you an overview about what we should think about in terms of knowing more about diabetes. So what we know, sorry, I just have to show this next slide, is that I actually received some funding from some of the pharmaceutical companies. None of this will be discussed in today's presentation. So my agenda for you today is I want to go over what is diabetes. I want to talk about how it's an appropriate way to manage your diabetes, and we'll talk a bit about some of the targets that are set for you and some of the standard treatment. I'm a big believer that individuals that live with diabetes need to become self-managers, so I'm going to give you some thoughts about how that can happen. Also, we're going to talk a little bit about knowing your diabetes team. We're going to then end by just sort of refreshing why managing diabetes is important, and then as Farah mentioned earlier, we'll have a question and answer period. So before I actually give you any information, I'd like you to answer a few questions for me, please. I would like to know where you're from, so it gives us a bit of an idea. Gives us a bit of an idea about your demographics as to where you live. So if you could just click on this and let me know which area of Canada you're from, that would be great. Okay, I think that's probably long enough for everybody, so let's see who's on the line today. So we have a large contingency of people from Ontario, about 50%, a few from BC and the prairies, and a couple from Quebec, and some from the Maritimes. So thanks very much for joining. The other question I'd like to find out is how old you are. So could you just let me know which age category that you fit into? under 19, 20 to 39, 40 to 59, or 60 to 79, or over 80? Okay, let's see. So we have a couple under 19. The majority of our participants today are between the ages of 40 and 59, and a few more over the age of 60. So thank you very much. All right, and I have one more question for you. And why did you join us today? Are you interested in learning more about diabetes because you live with type 1 diabetes yourself, or you live with type 2 diabetes? You're at risk of diabetes or have been told that you have prediabetes. You've had diabetes in pregnancy, you have it currently, or you had it in the past, which is known as gestational diabetes. Or really important, maybe you're on the line because someone you love lives with diabetes and you want to learn a bit more information about that. So I'll just give you a couple seconds to choose that. And let's see. So it's great to see that we have quite a few individuals who are here today because they care for someone that lives with diabetes. And then the majority of individuals live with type 2 diabetes, but we have a few people at risk and a few people with type 1 diabetes. So hopefully you'll find something for everyone in this presentation. And really what I wanted to help you understand, though, is that no matter where you come from joining this webinar today, is that you're not alone. So what we understand is that the incidence of diabetes in Canada currently is about 4.8 million, or 11%, is it 3.3 million, or 9% of Canadians are living with diabetes in the year 2014. So every year in November we put out new statistics. And we also understand that by the year 2024, it's estimated that the prevalence of diabetes will be about 4.8 million, or 11.8% of Canadians. And unfortunately, this is a statistic that has been rising more rapidly than we had ever predicted. The other very scary part is that 1 in 33 Canadians have diabetes and don't know it. So for those of you that have joined that are at risk or have been diagnosed as prediabetes, then you aren't part of this class. You actually know that you're at risk. And here we have a whole other set of people who are walking around with diabetes and have yet to been diagnosed. We take diabetes very seriously. I've spent my entire career looking after individuals living with diabetes. And one of the things that we understand is that people with diabetes are 3 times more likely to be hospitalized with heart disease than someone without diabetes. And what we really try to do is make sure that we take care of people's hearts. So that's what's really important to us, as well as all the microvascular complications, is knowing that there's such prevalence of heart disease in people that live with type 2 diabetes. So what is diabetes? So this is a very general definition. Diabetes mellitus, as it's commonly referred to, is diabetes in the short term. And we understand it to be a group of metabolic diseases in which there's high blood glucose levels over a prolonged period of time. And symptoms of high blood sugars can include frequent urination or going to the washroom more frequently, increased thirst, and increased hunger. We also understand that there are different types of diabetes, but in general, diabetes is due to either the pancreas not producing enough insulin or the cells of the body not responding properly to the insulin produced. And there are really 4 main types of diabetes that we talk about. So today I want to cover off with you type 1 diabetes, type 2 diabetes, gestational diabetes, which is the diabetes that occurs in pregnancy, and talk a little bit about prediabetes. There are other kinds of diabetes that are known, but none of those are something that we're going to cover today. And typically they might be diabetes that's related to being on a high dose of a medication like a steroid. That's a very transient diabetes. So let's move on to talk about what we understand. In terms of type 1 diabetes, it's usually diagnosed in children and adolescents, and the older we get, the less common it is to be diagnosed. Type 1 diabetes occurs when the pancreas is completely unable to produce insulin, knowing that insulin is a hormone that controls the amount of glucose in the bloodstream. And when we look at the overall statistics of the individuals in Canada affected by diabetes, it's about 10% who live with type 1 diabetes. Now, I mentioned that it usually occurs in children and adolescents, but we're seeing people diagnosed with type 1 diabetes further along in the continuum. So some people are diagnosed now in their 40s or 50s, but typically it's diagnosed younger in life, so typically children, adolescents, and young adults. So our more common form of diabetes is type 2 diabetes. Of our 100% of people diagnosed, 90% of them have type 2 diabetes. And this is a little bit more complicated. In type 1 diabetes, the pancreas doesn't make any insulin. In type 2 diabetes, the pancreas doesn't make enough insulin, or the body cannot use that insulin effectively, and so there is a resistance to the insulin in the cells. Now, we understand that this is a type of diabetes that typically develops in adulthood, typically later in life, although unfortunately we're starting to see an increasing number of children in high-risk populations being diagnosed with diabetes. So we're seeing in Manitoba, we've seen children as young as age 7 being diagnosed with type 2 diabetes. So this is really a reflection of an epidemic that we need to start to understand a bit better. When we talk about gestational diabetes or diabetes in pregnancy, for many individuals, this is a temporary condition that occurs during pregnancy. It doesn't always occur in every pregnancy for every individual, but it affects to about 2 to 4% of all pregnancies in individuals from the non-Aboriginal population. The rate of gestational diabetes tends to be a little bit higher in the Aboriginal population. Unfortunately, when the mom has diabetes during pregnancy, it involves an increased risk of developing diabetes for both mom and for baby. So this is one of the reasons that we also take diabetes in pregnancy very serious, and we really want to make sure that moms get screened for diabetes after they have delivered their baby in their postpartum or after baby period of time. That it's important that moms go back and have screening done to see whether or not they have actually the diabetes has gone away after the pregnancy, or if they continue to have difficulties with their blood sugar. Now, what about prediabetes? Well, I've been around long enough that we used to say that someone had borderline diabetes, and we don't say that anymore. We say that people have a disease state called prediabetes. We know that it's blood sugars are not high enough to be diagnosed with diabetes, but they're not normal. There's about 5.7 million Canadians who are living with prediabetes. Now, when we diagnose diabetes, it's with a fasting blood sugar of 7 or higher. So individuals with prediabetes do not have normal fasting blood sugars, but they're under 7. So they're at risk to going on to develop diabetes. Typically, about 50% of people who have abnormal blood sugars, considered in prediabetes, will go on to develop full type 2 diabetes. And what's really important to understand about prediabetes is that it carries the exact same risk of heart-related complications such as heart attack and stroke as someone who's been diagnosed with diabetes. The other thing that's really important to understand about prediabetes is that a healthy lifestyle can certainly help to prevent from converging to full-blown diabetes. So healthy eating, healthy weight, physical activity, and we can control blood sugars in this very early stage before the diagnosis of type 2 diabetes is made. It's not just a little bit of something. It's actually a disease state that we need to take seriously because we really want to protect people from getting complications related to diabetes and abnormal blood sugars. So this is kind of a little bit of a picture to help you understand what happens in diabetes. So in the center here we have the pancreas, and we know that the pancreas is where insulin is produced, and it can't make enough insulin. So in type 1 diabetes, it doesn't make any, and in type 2 diabetes, it doesn't make enough. And then on the other side of the screen, on the left-hand side, you see a picture of a muscle. And the muscles can't use sugar properly. They're resistant. They don't allow the little bit of insulin in the body to be able to get inside the muscle to give it sugar so that it can work properly. So the muscles are tired. And the liver has a part to do in the diagnosis of type 2 diabetes, especially because it makes sugar you don't need. So often when we think about where does sugar come from in our bodies, we automatically think about the sugar that we eat, the food that we eat, the carbohydrates that we take in, the breads, the sweets, the juice, the fruit. But in fact, within the body, the liver is also making sugar that you don't need. And when there's not enough insulin in the body, the liver continues to make sugar you don't need because the liver gets feedback that says the body needs more sugar because the muscles are starving. So this is what happens in diabetes, especially in type 2 diabetes, in terms of the different parts of your body that's involved. When we want to treat diabetes, what we're trying to do is help the pancreas make more insulin or replace the insulin that the pancreas can't make. We're trying to help the muscles be able to use the sugar properly so they have energy and they can do the job that they need to. And we try to make sure that there's enough insulin in the body so that the liver stops making sugar that you don't need and that it just makes sugar when you need it because you haven't had enough food for a period of time. That's the job that the liver is supposed to do. So I hope that you understand what the different types of diabetes are and the role that the different organs in the body play. And now what I'd like to do is move on to talk a little bit about how we would like to treat your diabetes or manage your diabetes in terms of targets and treatments. Now, this is a very busy slide, and I did this on purpose because when you're diagnosed with diabetes, all of a sudden there are so many things that you need to start to think about. And there's so many terms that your healthcare providers are going to throw at you. They're going to start talking about your before meal blood sugars and your after meal blood sugars, and they're going to talk about your fasting glucose levels, and they're going to talk about your weight and where it should be, and they're going to talk about your blood pressure, and they're going to talk about your cholesterol, and they might be talking about other things as well. Now, with all the busyness that's on this slide, the important thing to remember is that all of these different targets are what we really want to be able to help you to achieve to prevent complications. So there is a role for managing your blood sugars, and whether it's before meals, after meals, or just the fasting. And at the top of the slide, what you see is the word A1C, which is the overall measure of your blood sugar control. So it's important that we look after blood sugars, but we also know for people living with diabetes that it's really important that we achieve and maintain a healthy body weight. And we also know for people who live with diabetes that cholesterol is really important to control to reduce your risk of cardiovascular disease or heart disease. And of course, your blood pressure. Your blood pressure has a target because it protects not only your heart, keep your blood pressure in a normal range, but it also protects all the small vessels in your body, like your eyes and your kidneys. So there's all these targets for a very good reason. It's about helping you to live a long and healthy life. But what's really, really important to think about when you live with type 2 diabetes is that everyone has their own targets. It's your diabetes. So what your neighbor has for a target or how your neighbor's blood sugars are controlled may not be the right way for controlling your blood sugars. It's very important that we individualize the type of care that we give you to the other medical conditions that you have, to your living circumstances, to side effects of medications. So everyone should have their own targets. And that means that that's something that you'll work together collaboratively with your healthcare providers to decide what the targets are for you. So you should never compare with John or Joe or Jane at the coffee shop about their diabetes because you might get confused, remembering that it really is just your targets and your diabetes. But if we wanted to give you a general idea of what your blood sugar target should be, there are three numbers that we talk about. So if you look at this chart that's in front of you, you can see at the bottom it says target for most people living with diabetes. So without any significant other complications or any other risk factors, your A1C, which is a measurement of your average blood glucose control for the last 2 to 3 months, should be 7% or less. So that's an overall picture for about 90 days before you have the blood test done. And the blood test to measure an A1C is done from the vein in your arm. So it's actually a needle stick and sent to a laboratory. The other two targets that you see, so across the top, you see fasting blood glucose or blood glucose before meals. And if you measure your blood sugar on a glucose meter, that range should be between 4 and 7. And in Canada, we use millimoles per liter. And in terms of fasting blood sugar, that's after a night's sleep. So usually it's about 8 hours. That's the target. And then before before lunch and before dinner. Also, the target is 4 to 7. Then we're very interested in people, especially those with type 2 diabetes, to see how well they do in food choices and how good their medications are matching the glucose rise from meals. So we have after meal targets. The after meal targets that we have are actually from the start of the meal. So from the time of your first bite to 2 hours later, we would like to see your blood sugar between 5 and 10. And if we're really having a hard time of getting your blood sugar A1C into control, then we may ask you to target blood sugars after your meal between 5 and 8. So 2 hours from the start of the meal and you were to check your blood glucose, we would want it somewhere between 5 and 8 or 5 to 10, depending. And again, this is a type of target that is often individualized to the person. But it's also a great way of understanding. Taking a blood sugar 2 hours after you eat is also a really great way of understanding how food affects your blood sugar levels, because that's about the time that your body's insulin should catch up, or any other medications that you're taking to help with after meal blood sugar should be working at their most effectiveness or at their best. So that's why we like the 2 hour after meal blood glucose levels as well, because it helps us make better choices in food, and it helps the medical people in your life help you to manage your medications more effectively to make sure that you stay within your target range. So when we think about how do we manage to get diabetes to targets, there's lots of treatments that need to be considered. And as you're beginning your journey with your diabetes, what we really hope is that you get some diabetes education, that all people have access to speaking with someone who has some expertise in diabetes and providing you with information to help you manage your disease. We know that physical activity is really important for not only managing your blood glucose levels, but it promotes weight loss, it reduces stress, and improves your overall fitness. We know that regular physical activity is also great for blood pressure control, as well as blood cholesterol or lipid control as well. So physical activity is something that we really encourage people to either start or do some more of, and to try to do it on a regular basis. And down the road in these webinars, there's going to be some more information on physical activity. There's a webinar specifically on that. And also there's a webinar specifically on nutrition. And of course, we know that the food that you eat really can affect your blood sugar levels. And so it's important that you get some information on what, when, and how much you eat and how much you should eat, because this plays a really important role in regulating your blood glucose levels. And I think one of the things about understanding nutrition is that label reading is very hard for many of us. And how foods can be packaged and marketed can be very confusing, because something could say it's sugar-free, but actually there's a lot of carbohydrates in it, and it's really about, sort of getting people to think about Sorry, I just got a bit distracted. I think some of you are having a hard time hearing me, so I'm just trying to get the phone to turn up a little bit here. So the nutrition, back to the nutrition, is that helping people understand when there might be hidden sugars in foods, how much they can eat, what their portions need to be like, how they can manage in situations such as parties or social events that they go to, or religious holidays. So having a counseling session with a dietitian can be very helpful in helping you make better food choices along the way. And of course, we've talked a little bit already about weight management. So physical activity and nutrition are very important for helping individuals to try to achieve and maintain a healthy body weight. And lifestyle management kind of encompasses everything, physical activity, nutrition, and weight, but it also is about stress. And I don't think that individuals realize how much stress on a day-to-day basis is affecting individuals' blood sugars. So higher stress levels certainly can increase blood sugar levels. So we would really want people to have an opportunity to think about some ways to reduce their stress to help to be able to better manage their disease. Also, other things that need to be thought about in terms of treating your diabetes is that medications. And so for people who live with type 1 diabetes, it's always treated with insulin from the time it's diagnosed. Insulin is typically taken 4 times a day or with an insulin pump. so that insulin is the way to manage diabetes, type 1 diabetes. But in terms of type 2 diabetes, often we start with lifestyle management, so physical activity and meal planning. Sometimes we start with 1 or 2 different oral medications, and maybe you'll end up on 2 or 3 different oral medications, and often insulin becomes part of the treatment of type 2 diabetes. But what's really important in type 2 diabetes, it's not the number of medications that you take. It's the fact that you want to control your blood sugars to your target levels to prevent complications of diabetes. So I often say to people who are diagnosed with type 2 diabetes, it really doesn't matter whether you're on 1 pill or 3 pills or whether you're on insulin. What really matters is that we control your glucose effectively. And I also often say to people with type 2 diabetes that insulin is likely going to be part of their treatment, so that people are understanding at the time of diagnosis that they may need insulin in 5 days, 5 weeks, 5 months, 5 years, 15 years down the road. But at some point in time, we know at least 60% of people with type 2 diabetes will require insulin to be able to manage their blood sugars effectively. And that's okay. Insulin's a really good drug. We've known it for almost 100 years. We understand how to work with it, and we know that it's very powerful in lowering blood glucose levels. Blood pressure is very important in diabetes, because we know that high blood pressure increases the risk of eye disease, heart disease, stroke, and kidney. So we have a different level of blood pressure that we're trying to achieve for people living with type 2 diabetes. We really want to see people, with all diabetes, we really want to see people with a blood pressure less than 130 on 80. So again, your neighbor's blood pressure might be high because it's over 140 on 90 and they don't have diabetes. But when you have diabetes, high blood pressure is anything over 130 on 80, and we really try to treat that blood pressure to get it under 130 on 80, knowing that good control of blood pressure also reduces the risk of complications in diabetes. And sometimes to manage your blood pressure, the same lifestyle changes that you've made to manage your blood glucose level will be very effective in helping you to reduce your blood pressure, and you may need medication to manage your blood pressure. There will be another webinar coming up in a very short period of time that talks about reducing your heart risks in diabetes, and in that session you'll learn a little bit more about how medications for blood pressure and cholesterol can also be used to help reduce your risk of heart disease. So what's important is that we look to try to achieve a blood pressure of less than 130 on 80, and that we incorporate lifestyle changes as well as medications if required. Knowing that, the majority of individuals with diabetes will have some difficulty with heart disease, we have a cholesterol target. And the only cholesterol that we really worry about is the bad cholesterol, which is called the LDL. We used to worry about good cholesterol and total cholesterol and cholesterol ratios, but now, to keep the message very simple, is for people living with diabetes, we want the LDL, or bad cholesterol, to be treated to less than 2.0 millimoles per liter. And sometimes the treatment depends on how old you are, and sometimes it depends on how long you've had diabetes, and sometimes it depends on how the other numbers of your cholesterol profile look. But in general, for most individuals, we target an LDL of less than 2.0 millimoles per liter. And often people need blood cholesterol medications to be able to achieve that level. And we know that there's other benefits to being on those medications as well. So that's talking about, in terms of managing your diabetes, that's talking about targets and treatments. So I mentioned how your target should be individualized to you. And I've just given you a very brief overview of some of the treatments that you can expect to discuss when you've been diagnosed with diabetes, or that you should want to discuss with your healthcare providers when you see them about your own targets and whether or not you're close to them, especially with things like blood pressure and cholesterol. You may not be able to measure those yourself the way that you can measure your blood glucose levels. Now, in order to help you manage your diabetes, what we really know is that you need to get some more information to become a self-manager. And the reason that becoming a self-manager with diabetes is so important is because diabetes is something that you live with all day, every day, and you're constantly making decisions. You're constantly making decisions about what food to eat, what physical activity you can do, what medication that you're taking, and this is where your diabetes educator really comes in handy. And I've been doing diabetes for a really long time, and back in the day when I first started, diabetes educators were typically nurses or dietitians. And now we know that there has been a lot more individuals from healthcare professions that have become very good at helping us understand diabetes. So your diabetes educator could still be a nurse or a dietitian. It might be a pharmacist. You may get a lot of education from your physician, whether it be your family doctor or a specialist, like a diabetes specialist or a heart specialist or even a blood pressure specialist. There are a lot of people who are exercise specialists who have been very interested in helping to teach people living with diabetes about healthy lifestyle. And so exercise specialists are also becoming very important in diabetes education. And there are many other individuals. We even think about the fact that there are public forums that are being given that are given by individuals who live with diabetes. So they are very helpful in helping you learn more information. Also, we know that people that specialize in feet like to do a lot of education. They like to help us understand how, taking good care of our feet is very important, but they also understand why it's important because they understand the rest of diabetes. So it really doesn't matter where you get your diabetes education from. What's important is that you do find some diabetes education, that you access it or that you get referred. What the diabetes educators really want to do is work with you to help you become a self-manager by giving you education about diabetes and then providing you with ongoing support, because there's a lot to learn when you're first diagnosed, and things change with time. We learn new things. We have bad habits that need to be broken. We have good habits that need to be established. So there's lots that we can learn from a diabetes educator. But some of the specific skills, so not just knowledge about, what kind of diabetes you have and your targets and how to eat better and how to exercise more, but there are things that are very specific in terms of skills. So we want to teach you how to monitor your diabetes, and monitoring includes things like blood glucose monitoring, checking your blood pressure, checking your feet, and others. And so you might monitor your own lipid levels. You might monitor how often your eyes are done. So monitor. So these are things that you need to learn to check or have checked for you. They want to teach you skills about how to manage your diabetes. So that includes making good lifestyle choices and how to manage your diabetes in terms of medications. So when you think about manage, it's things that you can do to make your diabetes better. So monitor is things to check, manage is things that you can do, and mostly they want to also promote good health. So they want to help you understand about preventing complications of your diabetes, about how you can make that happen, and the different screening tests that you have. So the overall summary is monitor are things you can check, manage is things you can do, and promote is things you can prevent. And that's what's really important, is that you learn to monitor, manage, and promote your own diabetes. In terms of what you can expect with your diabetes educator, there's another session coming up in terms of, and it's called Setting SMART Goals. So we want goals that are specific, measurable, achievable, realistic, and timely. But whenever you decide a goal, whether it's a SMART goal helped with you by a healthcare professional or not, we know that to achieve a goal, we have to have an action plan. So what you see on the screen here is an example of what you might expect from your encounter with your healthcare professional around your diabetes. So you can see the change you want to make happen is, so after you've had a counseling session, you'll decide what you might want to work on and what that goal is. So let's say you've decided that the change you want to happen is to increase your physical activity, and right now you do none. So your goal for the next month is that you'd like to walk at least 15 minutes every day. And then you develop an action plan, so specific things that you need to work towards achieving your goal. And then you identify things that might be barriers, so things that might make it difficult for you to achieve your goal. and how you're going to overcome that. So maybe it's because, you live in Winnipeg and it's really cold and it's hard to go outside. So perhaps you decide that you're going to join the mall walking program at one of the local shopping centers because it's warm inside and there's lots of people doing the walking program. Support and resources that you'll need. Maybe you need your daughter to drop you off at the mall on the way to her job so that you can just take the bus home, and that would be support to get you there. We also want to understand how important your goal is to you and how confident that you are. So if it's important that you want to do it, that you feel that you're confident enough to be able to do it when you leave from the visit with your educator. And of course, to set a follow-up with you as well, to make sure that you feel that you have an opportunity to come back and discuss how you've done and change the action plan, increase the goal, or just maintain it. It really depends on you. This is your action plan. Now, in terms of thinking about all of the people in your life who might be helping you with your diabetes, you may have people who help you now and you don't actually realize that they're part of your diabetes team. And you can see this is our diagram from the Canadian Diabetes Association that helps people to think about all those individuals who should be part of their diabetes team, such as their eye doctor or their dentist, or other people that you know who have diabetes because you're going to share some stories with them. Maybe you need to see a social worker because your diabetes is very expensive and you're having trouble managing the medications in terms of cost. And your family is part of your diabetes team. That's really important to ensure that they're included in what you're doing and that they understand what some of your needs are. But what's really important about your diabetes team is that you're in the middle. You are the person who's the captain of this team, and everybody there is there to support you. And it's your diabetes that you're going to make decisions about, but these are all of the people who can help you with knowledge and skills and information and support to help you to achieve your goals. Now, one of the other things that your diabetes team will help you understand is being prepared for your diabetes visit. And I know that this might be very hard for some of you to read because it's very tiny print, but I downloaded it right from the Canadian Diabetes Association website. And there's a lot of things to think about when you go to see your healthcare professional about diabetes. And so what you can see on this particular piece of paper is on the left-hand side, it says how to get ready for your diabetes appointment. So some of the things that you want to remember to do, like taking a list of your medications or bringing your blood glucose levels with you. And on the right-hand side, what it tells you is what to expect when you go to see a member of your diabetes healthcare team. So what you should be expecting them to do for you related to your diabetes. And it's things like that you should be seen about 4 times a year, that you can expect conversations about physical activity, nutrition, food choices, smoking, how you're feeling with your mood, that you will have a review of your medications, that you'll have a foot exam done, and these are some of the things that you would expect. And this is a really great tool that you can download to make sure that that you are able to use this information to go and make sure that you get what you need at your diabetes visits, or so that you're not surprised at what's happening when you're there. Now, in terms of monitoring your own progress, so this is a flow sheet that you can keep track of your diabetes and how you're doing in terms of achieving your goals. So there's things on here like, the date, what your target goal is and how you're achieving it. So things like weight, your overall A1C, how often you're monitoring your blood sugars, how your kidneys are doing, how your feet are doing, how your blood pressure is, about your cholesterol levels. So these are kinds of things that you can keep track of yourself, and often this is very handy to take from healthcare provider to healthcare provider, because sometimes the information doesn't travel as fast as you do from one healthcare provider to another, or it isn't consistent with the way that their charts are set up. So you will always have this information for you and the other members of your healthcare team to see how you're doing. And last but not least, and I know you won't be able to read this one, but on the back of it, it is all of the things that you can understand in people who live with diabetes language. So what your weight should be and why, what your waist circumference should be and why, what your blood pressure should be and why. And it gives you some great learning about why we do what we do, a lot of which I've talked about today on this teleconference. But I think what's really important to understand is no matter what we do, no matter what type of diabetes you have, no matter what your targets are, no matter what your individualized treatment looks like, or your medications or your insulin dosages, or your blood pressure medications or your cholesterol medications, what we're really trying to do when we help people living with diabetes and educate them is to prevent the complications. That's why managing diabetes is so important. And these are some of the most common complications that people think about when they have diabetes. And these are things that we can actually work together to achieve your targets and to prevent. We know that the rate of amputations has gone down. We know that the rate of heart attacks has gone down. We know that the rate of dialysis has flattened. People are having much less difficulties with their eye disease and having changes at the back of their eye. Neuropathy is loss of feeling, and again, that's also something that used to happen to 90% of people. Now it's about 60% of people. But why we manage your diabetes is we're trying to protect your very precious organs, and that's why managing diabetes is so important. So I'm just about ready to stop for questions, but what I'd like to do with you before I do that is just ask you. I have touched the very tip of the iceberg. I've tried to give you a very general overview of what diabetes is and what targets are, and what kind of education and treatments in a very generic way that you might expect, and to give you some tools that you could expect to use to manage your diabetes. But what we'd like to know is, what would you like to hear more about? And some of these are in upcoming sessions. So we know that there's a session on nutrition coming, and there's one on physical activity. There's one on preventing heart complications. There's one on mood coming up as well. So these are some of the topics, and they will certainly help us to be able to formulate some of our future webinars. So I think if everybody's had a chance to vote, we'll see what the most common topics are. So people still want to learn more about their medicines? Absolutely, because that medicine toolbox has really changed in the last 5 years. And of course, preventing complications, because that's what it's really all about. So I want to thank you for answering that poll for me. And at that point, I'm actually going to stop, and I'm going to turn it to Farah, because I believe Farah has some questions that have been typed in. And
yes,
I
do.
And also,
thank you so much, Lori.
Hang on
Sure.
a second, Farah. Just at the bottom of this slide, so if you want more information, you can always go to your local CDA office, Canadian Diabetes Association office, or call them. You can call 1-800-BANTING. A lot of really great tools are on diabetes.ca. So there you go, Farah. Now you can have the floor.
Thank you so much, Laura. You've shared with us a lot of really important information, and there's been definitely a lot of great takeaways. I'm sure all the participants can agree. Throughout the session, there has been quite a bit of questions that have developed. So I guess we'll go through them until we're kind of at the end.